My name is Callahan. Good afternoon, I am actually a trained oncology nurse. I've been a nurse for 17 years, oncology for maybe 14. But my topic is mental health education and screening for children. And I chose the topic just because I've seen misconceptions in the community with what people think mental illness is, and if we can start education at a young age, maybe we can remove some of those misconceptions and also teach children self-help techniques and stress management techniques at an early age. So after the presentation today, the audience will be able to differentiate mental health from mental illness, discuss current health education practices for elementary level students in New York State, and explain reasons why change is necessary. So a couple key terms before we get started. Mental health is not just the absence of a mental illness. It's actually defined as a state of well-being where every individual realizes their own potential, can work productively and fruitfully, and be a contributing member to society. Mental illness is a medical condition that disrupts a person's thinking, feeling, mood, and ability to relate to others and their daily functioning. The definition for health education from the CDC actually states, and on this one I will read to you, provides students with opportunities to acquire the knowledge, attitudes, and skills necessary for making health-promoting decisions, achieving health literacy, adopting health-enhancing behaviors, and promoting the health of others. This definition I found actually when I was trying to make sure that all of my links worked for my references, was just changed at the end of February. And the definition was changed at the end of February, and they also included in the change for the definition, they included suggested topics this time when they have the definition. And their suggested topics to include were drug use and abuse, alcohol, drug use and abuse, nutrition, healthy eating, personal health, and mental and emotional health. Mental health was never mentioned previously in the definition or in suggested topics. So obviously they are looking at the needs of the community and the population and changing a few things, hopefully. For some background, as stated, I believe that Melissa stated it earlier too, it's estimated 1 in 4 adults suffer from a diagnosed mental disorder in any given year. And that the range for children is between 12 and 27% might have acting out behavioral problems, depression, and anxiety. It seems to be a pretty wide range, but some of the studies that were reviewed actually had a very narrow scope and were only looking at maybe 1 or maybe 2 behaviors, and those had a tendency to have a smaller percentage for what the incidence was. When you look at the overall behavioral problems, depression and anxiety, it really is closer to 20 to 25% than to those outliers. And John Rowe reported in 2010, untreated mental disorders in children can lead to low self-esteem, decreased academic success, and poor social and familiar relationships. So why is all this relevant? As many as 1/4 of U.S. children could be living with and displaying problems of mental illness, but as few as 1/6 to 1/3 actually receive any treatment according to Least et al. In 2007. Mental health issues can cause disruption in the classroom to both the teacher, the child affected, and to the other children. We need to remove stigma and increase awareness community-wide. According to the National Alliance on Mental Illness, there were 4,197 children incarcerated in the juvenile system in New York State in 2006. They also reported a nationwide statistic that of children incarcerated in the juvenile system, 70% were experiencing mental health issues. They don't give there was no incidence for how many of those roughly 4,000 children in New York State were experiencing mental health issues, but if we're anywhere near that nationwide statistics of 70%, that's a pretty large number. The results of the study conducted by Neil Clark and Jones in 2011 suggest if we refocus our prevention efforts and gear them towards the elementary level instead of focusing them on the secondary level, that we can actually yield greater results for children. So if we look at the numbers in reference to or in relevance to the classroom, The average number of students in any given primary school in New York State is 576. If we look at a number, only if we just take 20% on the lower end, if we say that 20% of children can be affected by acting out behavioral issues, that would be 115 students in every primary school to be affected. Mental and emotional health issues can lead to bullying, increased juvenile delinquency and dropout rates, and poor performance on achievement tests. A study was conducted by Guzman et al. To determine if screenings could predict standardized test scores. And the Chilean government institutes reported screenings of children in approximately 20% of their elementary schools. They do 2 screenings. They have the parent screen their child, and then they also have the teacher screen their child. The screenings were completed in 1st grade, and after the 4th grade standardized tests were completed, they compared their test scores. For students who had 1 positive, and it didn't matter if it was a parent positive or a teacher positive, they reportedly had test scores that on average were 14 to 18 points lower than students who had no positive screens. And for those students who had 2 positive screens, the teacher and the parent both said that they may have acting out or behavioral issues or some other internalizing issues. Their scores were on average 33 points lower than students who had no positive screens. And according to that Guzman study, mental health issues in the 1st grade were one of the strongest indicators for the lower performance tests, or the lower achievement tests in 4th grade. So continuing with classroom relevance, again, the poor performance on achievement tests, it seems kind of petty to mention, however, they will affect a school's performance as well as they're affecting the child, which may be a motivation for the school as well. If they're not thinking about the individual children themselves, if they're thinking of their school scores and their school performance, that may be a drive for them as well. And in New York State, according to the regulations for the Commissioner for New York State, the regular classroom teachers are responsible for teaching health education in the primary level. And the National Association for School Nurses recommends a minimum of a bachelor's degree for school nurses. This places the school nurse in the perfect position to not only assess mental health issues and concerns, but also to act on and make referrals as necessary. The regular classroom teachers, however, is not within their scope of practice to assess. So our PICO statement, our population is late elementary school children, intervention is mental health education and screening, the comparison is no education or screening, and our outcome is the primary, secondary, and tertiary prevention. So in late elementary school children, how does mental health education and screening compared to no health education or screening affect primary, secondary, or tertiary prevention? And the secondary purpose would be the vocabulary provided will assist the students in engaging in conversations with peers, teachers, and nurses. So I chose LEWIN'S change model as well. It seems to be one of the popular ones today. I think this is a good illustration of the change. The apparent equilibrium is the frozen stage, and as we look at the pictures, as we think everything is cohesive and status quo in the beginning, and as we realize that there is room for change or there is a need to change, the status quo begins to fall apart. As we motivate individuals and get everyone on board, the change starts to come together, and in the refreezing stage, we now have the new organized model. So for our restraining forces and driving forces, with LEWIN'S change model, there's restraining and driving forces for every change. The restraining forces are just as it sounds. The restraining forces are restraining and resisting that change, and the driving forces are assisting us to make that change and pushing it forward. And you'll notice that I do have teachers in both the restraining and driving forces. The parents could probably be in both as well. It's really going to depend on where you are in LEWIN'S model as far as who may be a restraining and who may be a driving force. And it's getting people on board. Administration may initially be seen as a restraining force, but as I said, when you start talking about the effect that it might have on a school's performance, that may change to a driving force. Society in general is also very protective over children, and many people will think that this is unnecessary. However, I feel that with all the stressors and pressures in the world today, you're really taking advantage of an opportunity to take unbiased viewpoints and establish them for what the world really looks like and what mental illness really looks like, and informing them of how to handle stress and the pressures in the world. An electronic search was completed using the listed databases between the dates of January 1st, 2000 and February 1st, 2015. There's actually a dearth of information with regards to elementary level mental health education and screening. Like I said, it is really geared towards the secondary level, and that is why I had to go back so long, why there's such a wide range for my search. Many things, there were pieces to the puzzle, few of them came together with everything. The combination of our synonyms for the listed terms were used in the search. The search was restricted to the English language, and the terms used were as noted. The reference lists from some of the articles were reviewed in order to identify other relevant studies. And of the 51 articles reviewed, 6 were chosen based on relevancy and actual study status, and anything that did not meet criteria was discarded. So if we look at this slide, there's 2 studies that have no mention of primary, secondary, and tertiary prevention or mental health screening, the Bronner and Stevens and the Fox et al. Both of those were pretty much an examination of either the prevalence of mental health issues in children, or they were looking at the knowledge that children already had, what their impression was of mental health issues. DeSocio had good recommendations for education, including the primary, secondary, and tertiary prevention. However, had no screening information, which I found kind of interesting. The overall themes from all the studies reviewed was that there was a need for more research. That there really is a need for head-to-head research to come together. This really is true in this point. I know it sounds kind of canned to say that there needs to be more research, but there truly is a need. The largest strengths identified were found by Essex et al., which revealed universal screening at school entry can identify children likely to develop comorbid symptoms. DeSocio found children's knowledge about mental health and illness improved with educational sessions, and the children actually were very happy with the educational sessions. They felt that they had more confidence in having conversations with their peers and their teachers and their school nurses. And they knew they had a better understanding of when to ask for help, and empowered them to actually have conversations with each other and their teachers. And in the elementary level, the O'Neill study in the elementary level showed that children that went through these classes exhibited better social, emotional, and interpersonal skills, and were better equipped with drug refusal skills than children who didn't take part in the class. And they also showed less aggression and drug use intentions. And the limitations of the review, they were really small cohort studies. Some of them were more exploratory in nature, and there were a couple that were more really a program initiative than really a true study. So the gaps, there's truly a need for a head-to-head analysis of really screening tools and educational programs. There's really no set screening tool for the elementary level. They mention talking to the children about mental health issues, but really it's more of a reaction to what's already happening than trying to screen for something that may be an internalizing behavior or may be just anxiety that's not displaying itself yet. It's really more of a reaction than a prevention for the elementary level. With any clear conclusion, they all have solid information concerning a piece of the puzzle, but they're really a more global view to pull the pieces together into a comprehensive plan. And O'Neill would be the strongest evidence available due to the fact it's a randomized controlled study. It provides the strongest evidence for starting prevention in the elementary level as opposed to delaying to the secondary level, and shows improvement in societal and interpersonal skills, and also decreased aggression. So for the strength of evidence, this is according to Lobianda, Wood, and Haber. The level 7 is listed as such because it's really a commentary on the differences between studies reporting the accuracy of prevalence of emotional and behavioral disorders. They don't mention what types of studies, whether the studies are quantitative or qualitative, so I was unable to determine if it was a higher level of evidence than the 7. All of the level 4 studies are non-experimental cohort studies. The level 2 is a randomized controlled trial, and the level 3 is a well-designed trial without randomization. And showing the lower levels of evidence, this really shows the need for, or supports the need for further randomized controlled trials and further research. So this is my opinion. Nurses are among, in my opinion, the most effective profession with regards to mental health aside from teachers. So if you think about the spectrum, school nurses are with people from the time of elementary school on through middle school, up through the high school and the secondary levels, hospital settings and clinics, workplace for corporations, and nurses practicing in the jail system. They all feel the significant impact of the mental and emotional health issues across the country. The regular classroom teachers are dealing with so much increase in demand for their time, for the changes in curriculum and the changes to standardized testing, that they really don't have the time nor the expertise. They don't receive any additional education to take on these issues. If changes are made to the mandated screenings, that may allow time for the school nurses to teach the children the health education classes that they need, and they may be able to teach coping skills and stress reduction techniques that we may be able to see less mental health issues further on if we deal with this in the younger ages. And the school nurses are in a unique position with regards to students who may be having issues with their teachers. If a child is having an issue with their teachers because of acting out behavioral issues, they may not feel comfortable going to her for assistance. The school nurses are considered a quote-unquote safe zone for the children. Susan Boland-Shepard completed her dissertation on the role of student nurses in the early identification, referral, and provision of services for students with early signs of mental illness, emotional, and behavioral disorders. She used focus groups from school nurses in suburban Massachusetts. And the school nurses got together as focus groups to discuss their experience with children and mental health issues. They reflected on the students using them as sounding boards, discussing their problems, using the nursing office as a safe place to get away from the stress of the classroom. They also discussed the unavailability of what they referred to as the experts, the psychologists and the counselors. When they were needed to intervene for a student, they were not available. There's not enough of them to be available for all of the students, so the students ended up seeking out the school nurse anyway. The nurses felt that they were frequently providing guidance such as refocusing, active listening, relaxation techniques, medication assessments, and change in case management for the students. And also, as a bachelor's prepared nurse, as recommended by the National Association of School Nurses, it is within their scope of practice to assess and refer to appropriate entities outside services. The first professional responsibility listed in the Code of Ethics for school nurses, according to the National Association of School Nurses, states an obligation to participate in the profession's efforts to improve school health services and promoting student health and academic success. With mental health issues causing disruption in the classrooms, causing lack of academic success for the students, lack of academic success for the schools in general, we refer to their assessments. Why would schools not take on the steps to change the system and improve the quality of life for the students? Especially with the recent shift for the CDC, it appears that it may be embraced from higher levels for adding a mental health assessment and education. So currently in New York State, the regular classroom teacher, as I said, instructs health classes. There are regulations set forth in the New York State Commissioner's regulations, and their regulation states planned activities for developing attitudes, knowledge, and behavior that contribute to their own sense of self-worth, respect for their bodies, and ability to make constructive decisions regarding their social and emotional as well as physical health. New York State does not mention mental health in their regulations, and there's no standard curriculum. They pretty much speak of hygiene and health and nutrition for the health classes. The only mandated screenings completed by school nurses are hearing, vision, and scoliosis. According to the CDC, hearing loss that would affect a child's learning is present in 14.9% of children. Visual disturbances, 2 to 10%, and scoliosis is present in 2 to 4% of children ages 10 to 16. So keep in mind we're saying that there's mental health issues, behavioral issues, emotional issues present in 20 to 25% of the children, And we're screening for things that have an incidence rate of as low as 2%, yet there's no screening for any mental health illness in the children. With regards to duplication of efforts, pediatricians are screening for the same things. So if duplication was stopped or limited, if we didn't eliminate it completely, or didn't remove it completely, but eliminated some of the redundancy, there may be more time for educating the students. So to apply this to nursing practice, school nurses will need to instruct teachers on the ABC method, and this is as discussed by Keuka and Bernardo. There's a couple different ABC acronyms out there. This ABC is appearance, behavior, and conversation. The program is really just taking advantage of a relationship that's between a student and their nurse and their teacher. And some of the faculty may already be doing this without realizing what they're doing. It's just kind of putting words to what they may be doing and explaining what they may be looking for. The regular classroom teachers are already currently strapped for time, and as I said, if we remove the redundancy and utilize the health education instructors, this may improve the atmosphere in the classrooms. The nurses are probably better equipped to deal with the conversations dealing with mental health and wellness than the teachers are. Suggested topics to include in such education, as noted by DeSocio et al., are the definitions and the differences in mental health and mental illness. How the brain affects our emotions and our behaviors, and explaining to children that this isn't something that you may have control over. This may be something that's within your brain. The examples that they gave and the explanations that they gave, children at a very young age can understand this. It's not something that's a higher level. You can gear it down to them to make them understand. They also suggested personal resource discussing stress and coping, and having them develop their own personal coping and stress management techniques, teaching them how just your stress technique may not be my stress technique. So helping them to decide what might work for them. And common mental health problems in childhood and on into adulthood. They discussed what the most common mental health issues may be. The results of the O'Neill study from 2011 looked at the effects an all-inclusive mental health education would have in an elementary school that I mentioned earlier, with a decrease in aggression and enhanced social skills, can be used to assist for lobbying for change. So my recommendation is to develop a comprehensive program in New York State to include mental health starting in the primary grades. Part of this development would be to assess if there are any current practices and systems. There may be some schools that have developed their own system that has something in place. If it's not published and it's not out there, no one knows. So part of that would be assessing to see what is already out there. And mental health screenings, if using the ABC method, can be a very non-abrasive, gentle means of assessing and increasing awareness on the part of all of the staff. Undiagnosed mental health disorders can cause problems with academics and socialization, as I said, more specifically concentration, absenteeism, group activities, and general learning. According to Keuka and Bernardo, 90% of teens who commit suicide have mental health issues at the time of their death and have never received any mental health services or treatment. 70% of children in the juvenile system nationwide have mental health issues. If we do not address these issues, we will have increased cases of mental health disorders and more disruption in classrooms. And starting this curriculum could improve the atmosphere in schools. Less aggression and better communication skills will help everyone in the schools and